Welcome to another deep dive with us. This time, we're taking on something pretty important, maybe even life-saving. We're talking about CPR and basic life support. We've got a whole bunch of manuals and guides, even some research papers here. And the goal is, well, imagine someone just collapses right there in front of you. Would you know what to do?
That's the question we're hoping to answer today. I've spent years in emergency response, and let me tell you, knowing how to handle these situations, it really is like having an extra superpower.
I love that analogy.
Yeah.
So we're talking about more than just putting a Band-Aid on a little cut, right?
Right. First aid, it's all about preserving life. Relieving suffering, doing what you can to prevent things from getting worse, and really just helping someone get on the road to recovery. A first aider is that crucial first link in what we call the chain of survival.
So before the paramedics get there, the first aider is potentially the most important person at the scene.
Exactly. And that's why understanding this role is so important. It's recognizing there's an emergency, figuring out what's going on, and then prioritizing what the person needs most.
Yeah.
You give them the right care, but just as importantly, when it's time to call in the professionals.
Well, our listeners are all about clear instructions, so let's break it down. What are those key steps in any emergency?
First, you have to assess the scene. Your safety always comes first. You got to look for things like downed power lines, fire, anything that could be dangerous. You can't help anyone if you become a victim yourself.
Right, that makes sense. You can't help if you get hurt yourself.
Exactly. Then you move on to the person, checking on them. And it always comes back to the ABCs. Airway, breathing, and circulation.
Right, the ABCs. Our research mentions things like responsiveness, breathing, and circulation.
Yes, exactly. You start by checking if they respond. Gently tap the person and ask loudly, "Are you okay?" And if there's no response, you got to check if they're breathing.
So we're looking for their chest to move, listen for them to breathe, see if we can feel any air.
You got it. Now, we used to check for a pulse as part of this step, but the newest guidelines say it's more important to look for any signs of life, any movement at all, or any breathing, rather than spending time trying to find a pulse.
So basically any sign that their heart is still beating.
Exactly. And if they don't respond and they're not breathing normally, or if you're just not sure, you call 911 immediately. That gets the pros on the way while you start giving care.
All right, so let's talk about CPR. It's really the heart of today's deep dive. One of the things we read said that if someone does CPR before the ambulance arrives, it can actually double or even triple someone's chance of surviving cardiac arrest. That's pretty amazing.
It really is. You see, during cardiac arrest, the heart's electrical system kind of goes haywire and the heart just quivers instead of pumping blood like it should.
Right.
So CPR comes in and it manually gets that blood and oxygen flowing to the important organs. It's like a bridge to keep someone alive until help arrives.
So how do we actually do CPR? I feel like I vaguely remember this from a first aid course years ago, but a refresher would be great.
Absolutely. First, you need to get in the right position. You kneel next to the person and put the heel of one hand right in the center of their chest between their nipples. Your other hand goes on top of the first one with your fingers interlaced.
Got it. The hand placement is pretty clear. And then we push down.
You push down, yes, but it's not just pushing. You have to push hard and fast. Aim for at least 2 inches deep and do it 100 to 120 times a minute.
Wow, that's a lot faster than I thought. Any tips on keeping that rhythm?
Think of the beat of the song Staying Alive. That's a good rhythm to keep.
Staying alive. Got it. Now, what about the breaths, those rescue breaths? I know some people aren't super comfortable with that part.
Those rescue breaths are really important because they get oxygen into the person's lungs. So after you do 30 compressions, you gently tilt their head back, pinch their nose closed, and make a seal over their mouth with yours. You give 2 breaths, about 1 second each, watching to make sure their chest rises.
30 compressions, 2 breaths, and keep going. Makes sense. But what if you just can't do the breaths, even though you know how important they are?
I understand, and in those cases, hands-only CPR is a good option. You just keep doing the chest compressions, that same 100 to 120 per minute, but without the breaths.
So even if I can't or just don't want to do the breaths, I can still possibly save a life just by doing compressions.
Absolutely. Any help is better than no help. Studies even show that hands-only CPR can be just as good as the regular kind in those first few minutes after cardiac arrest.
Okay, well, I already feel more prepared just hearing that, but I know there's more to BLS than just CPR. Right? What about those AEDs we see everywhere in public places? Those things seem a little intimidating.
AEDs, or automated external defibrillators, are incredibly important tools. They analyze the heart's rhythm, and if they need to, they can deliver an electric shock. You can think of it like a reset button for the heart.
So it's basically a small defibrillator that anyone can use. But how would I know how to use one of those?
They're actually really user-friendly. They literally talk you through every step of the process. You turn it on, attach the pads, it analyzes the rhythm, and if it says to, you deliver a shock. Then you go right back to CPR.
Wow, that's incredible. So even someone with no medical training could potentially use an AED to save a life.
Exactly. And the most important thing to remember is the sooner you use an AED, the better the chances are for survival.
Okay, so we've covered CPR and AEDs. Those are like the core things. Our listeners really into that step-by-step kind of knowledge, those cheat codes to navigate an emergency. And what we found is there's this thing called the BLS algorithm that seems really important.
Oh, that's a great point to bring up. The BLS algorithm is like a mental checklist you use to respond to cardiac arrest. It makes sure you're doing all the right things in the right order. It's really helpful.
Let's break that down then, step by step.
Yeah.
That's what our listeners want to hear.
So the BLS algorithm, it starts with that initial assessment, checking if they're responsive and breathing. If they're not responsive and not breathing normally, right away you shout for help, make sure someone's calling 911.
So we're getting help on the way right away.
Right. And then you start chest compressions immediately. Remember, 100 to 120 compressions a minute, pushing down at least 2 inches each time. And if you're trained and comfortable with it, you give 2 rescue breaths after every 30 compressions.
Compressions first, then breaths if you can. Got it. So what's next in the algorithm?
Next, as soon as you have it, you hook up an AED. The AED will check the person's heart rhythm and tell you if you need to give a shock or not.
And if the AED says to give a shock?
Then you push the button on the AED to deliver the shock. But it's super important. Everyone's got to be clear, not touching the person when that shock happens.
Safety first, always.
Yeah.
So then it's shock, and then back to compressions.
Exactly. After a shock, or if the AED says no shock is needed, you go right back to CPR, starting with the chest compressions.
So it's kind of a cycle, CPR, and then the AED is part of that. And we just keep going until the EMTs arrive.
That's right. The BLS algorithm gives you that clear roadmap for dealing with cardiac arrest. It helps you make sure you're doing all the right things in the right order. It's like having a flow chart in your head.
This algorithm is amazing. It really takes out the guesswork in those high-pressure situations.
That's exactly it. It helps you stay calm, stay focused, even when you're dealing with, a life or death situation.
Okay, let's shift gears a little bit. We've talked a lot about CPR and cardiac arrest, but there are other situations where someone might need first aid, right? What about those cases where it's not cardiac arrest, but they still need help fast?
You're right. Those are important too. Things like choking, serious bleeding, shock, knowing what to do for those can be just as important.
Let's start with choking. The CPR handbook, one of the sources we have here, it describes choking as a blockage of the airway, usually by food or some kind of object. That sounds really scary.
It definitely can be scary. It's important to act fast. Someone choking might suddenly grab their throat. They won't be able to talk or cough. Their face might turn red, even blue.
So what should we do if we see someone choking?
What works best is a combination of back blows and abdominal thrusts.
Back blows first. How exactly do we do that?
You stand behind the person and lean them forward a bit. Then, with the heel of your hand, you give 5 firm blows between their shoulder blades.
And what if the back blows don't work? They're still choking.
Then you move on to abdominal thrusts. It's sometimes called the Heimlich maneuver. You stand behind them, wrap your arms around their waist, make a fist with one hand and put it right above their belly button. Then you grab your fist with your other hand and give 5 quick thrusts, kind of inward and upward.
It sounds like you need to use some force with these techniques.
You do need to use force. Remember, you're trying to dislodge something that could be life-threatening.
What if the person stops responding while you're doing this?
If that happens, you lower them to the ground right away and start CPR, beginning with the chest compressions.
So back blows, abdominal thrusts, and CPR if you need to. Got it. Now, what about bleeding? When someone's bleeding a lot. The research mentions direct pressure, elevation, and tourniquets.
Right. The first thing is always to protect yourself. Wear gloves if you have them. Then you put direct pressure on the wound using a clean cloth or bandage.
Direct pressure, so basically just pressing on the wound to stop the bleeding.
Exactly. And if you can, you lift the injured part, the arm or leg, up above their heart. That helps slow down the blood flow too.
Okay, what about tourniquets? Those seem like you'd only use them in extreme cases.
You're right. Tourniquets are only for those really serious bleeding situations where nothing else is working.
So, if the bleeding is life-threatening and direct pressure isn't working, or maybe if it's obvious that a major artery is cut, then you might need a tourniquet.
Right. And it's really important to have the right training on how to use a tourniquet. You basically put it about 2 inches above the wound, tighten it until the bleeding stops, and then secure it.
So tourniquets, they're a powerful tool, but you really need to know what you're doing to use them safely.
Got it. Now, what about shock? It seems like shock can happen in a lot of situations, not just when someone's bleeding.
That's true. Shock is a really serious condition. It happens when the body isn't getting enough oxygen-rich blood to the vital organs. And it can be caused by a lot of things: severe bleeding, allergic reactions, heart attacks, even just extreme emotional distress.
So it's like the body's response to something really serious going wrong.
Exactly. And the signs can be things like their skin being pale or clammy, breathing really fast, a weak or rapid pulse, maybe even confused.
What do we do if we think someone's in shock?
First thing, call 911. Then help them lie down and, if you can, raise their legs up. That helps get the blood flowing to those important organs.
Lie down, legs up. Is there anything else? If they're conscious and not throwing up, you can offer them little sips of water. But don't give them anything if they're unconscious or you think they might have internal injuries.
Small sips of water if it's safe, but nothing else.
Yeah.
And then just keep them warm and comfortable until help gets there.
Exactly. And just keep reassuring them, talk to them calmly. You being calm can really make a difference for them when they're stressed like that.
I'm starting to feel like I could actually handle these situations now. It's like we're building this whole emergency response toolkit: ABCs, CPR, choking, bleeding, shock.
That's the idea. The more you know about first aid, the more confident you'll be in an emergency. But remember, all of these techniques might need to be adjusted if you're dealing with a child or an infant.
Ah, yes, children and infants. I bet those situations need a little extra care and maybe some different techniques, right, Day?
You're absolutely right. Let's start with CPR. With a child or infant, you're going to use just one hand for chest compressions. You push down about a third of the depth of their chest.
Okay, one hand, and not pushing as deep. What about the speed? How many compressions per minute?
The speed stays the same. You still do 100 to 120 a minute, and you still do 2 rescue breaths after every 30 compressions.
So the main differences are the hand placement and how deep you push.
Exactly. And just remember to be gentle, especially with infants. They're so small and fragile.
And what about choking? Do you do different things for children and infants when they're choking too?
Yeah, for babies, you're going to use back blows and chest thrusts instead of abdominal thrusts.
Back blows and chest thrusts. How do you do those on a tiny baby?
For back blows, you hold the baby face down on your forearm, supporting their head and neck with your hand. And then with the heel of your other hand, you give 5 firm blows between their shoulder blades.
And chest thrusts.
You turn the baby face up, still on your forearm, supporting their head and neck. Then you put 2 fingers in the center of their chest, just below the nipple line, and give 5 quick thrusts downward.
So it's like the adult techniques, just adjusted for a little baby's body.
Exactly. You just have to adapt things to the size and how fragile a child or infant is.
This is so helpful. It really feels like we're giving our listeners a complete guide to handling all kinds of emergencies, from CPR to helping someone who's choking, stopping bleeding, managing shock.
That's exactly what we're aiming for. But it's not just about the physical techniques. It's also important to think about the mental and emotional side of providing first aid. Our sources talk about incident stress, which can be a big deal.
Yeah, that makes sense. It's got to be stressful to deal with those situations, even for people who have training.
It really is. Giving care in a high-stress situation, it can affect even the most experienced rescuer. It's not just physical, there's an emotional toll, too.
So even if you do everything right, you might still feel some after effects.
Oh, yeah. It's totally normal to have a lot of different emotions after an emergency: adrenaline, anxiety, maybe even guilt or self-doubt.
That feeling of, what if I could have done more?
Exactly. That's a normal reaction to something traumatic. The key is to acknowledge those feelings and get support if you need it.
Our sources talk about talking to someone you trust, getting counseling, doing things for yourself like medication or exercise.
All great strategies. And remember, you're not alone. There are resources out there to help you process the experience and move forward.
We've really covered a lot today, haven't we? Basic first aid, CPR using an AED, specific situations, personal safety, what to do about infections, even how to deal with the stress afterwards. It's amazing how much goes into being prepared.
I agree. It's been great to talk through all of this with you.
You know, I'm feeling kind of ready. Like, we've actually been given the tools to maybe be those everyday heroes. The people who step up when there's a crisis.
That's what's so great about first aid. It turns us from just watching to actually doing something, being able to make a real difference.
And it all starts with that choice to learn, to be prepared, to be the one who takes action when it's needed.
That's right. So for all our listeners out there, the question is, what are you going to do with this knowledge? Will you just file it away, or will you take the chance to be that everyday hero?
You have the power. We really hope this deep dive has inspired you to get some training, learn the skills, and get confident enough to act when it matters most.
It's funny. While we're going through all these different techniques and scenarios, I keep thinking, what if you're the only one around when something happens? It's got to feel different when you're the only one there to help.
That's a good point. It's definitely a situation we should all be prepared for. But the good news is you can still do a lot even if you're alone, right? It's all about figuring out what's most important and adjusting to the situation.
Exactly.
So, okay, let's say I'm hiking somewhere, miles from any cell service, and I find someone who's injured, not responding. Where do I even start?
The basics are the same, no matter what. First, your safety, really check the scene for any dangers before you even go near the person. Once you know it's safe to approach, you can start checking them out.
So I've checked things out, I'm with the victim. What next?
If they're not responding and they're not breathing normally, the most important thing is to get EMS activated, call for help.
But what if I'm out in the middle of nowhere with no signal?
That's when you might have to decide whether to leave them and go get help.
Wow, that's a tough decision. How do you even decide what to do?
It's a balance, weighing the risks and benefits. If the person's in immediate danger, like trapped in a burning car or something, you might try to move them to safety before you go for help.
Okay, so let's say I've either called for help or gone to find it. What do I do while I'm waiting?
Well, if you are able to contact EMS, you want to give them really clear directions to where you are and describe what's happening. Then you start giving care based on what the person needs. If you had to leave to get help, make sure you can lead the rescuers back to the exact spot.
Got it. So once help is on the way, I just focus on keeping the victim stable and comfortable until they get there.
Exactly. You keep an eye on their breathing, keep them warm, reassure them. Any support you can give will help until the professionals arrive.
This is making me feel a lot more confident, like even if I'm alone, I can still take control of the situation.
That's the attitude. Knowledge and preparation, they're what give us the power to act, even when things seem really overwhelming.
We've talked a lot about the skills and stuff, but there's also the mental and emotional side of first aid. One of the manuals we read even talks about incident stress.
Yeah, that's a big part of it, and it's something people don't always talk about. Giving care in a high-pressure situation, it can affect anyone, even someone who's done it a lot. It's not just physical, it's emotional, too.
So you're saying even if you do everything right, you might still feel kind of messed up afterwards.
It's completely normal to have all sorts of emotions after an emergency: adrenaline, anxiety, even guilt, or thinking you should have done more.
Yeah, that feeling of, what if I could have done more?
Exactly. And it's a natural reaction, after you've been through something traumatic. The important thing is to recognize those feelings and reach out for support if you need it.
Our sources talk about talking to someone you trust, maybe getting counseling, or doing things for yourself like meditation or exercise.
Yeah. Those are all really good ideas. And remember, you're not alone in this. There are people and resources out there to help you process what happened and move on in a healthy way.
Well, we've really covered a lot of ground today. Basic first aid, all the steps of CPR, how to use an AED, specific situations, personal safety, infection control, even how to deal with the stress afterwards. It's pretty amazing, all the things that go into being truly prepared.
I agree. It's been great talking about all this with you.
I'm definitely feeling more prepared and more confident about being able to handle an emergency if one happens.
That's what we want. You don't need a cape to be a hero, right? You just need to be willing to learn, prepare, and care.
That's a great way to put it. And on that note, I think we've come to the end of our deep dive into the world of CPR and first aid. We hope you learned a lot and feel ready to handle whatever comes your way. Stay safe, stay prepared, and until next time, keep on diving deep.